Hi, welcome to class. Thank you for coming. Today in lesson 4, we will be talking about chapter 5 and chapter 6. We'll be covering obsessive compulsive disorders, the impulse control disorders, somatic symptom, and dissociative disorders. So we have a lot to cover today. So I will be quickly going through our PowerPoints. Again, if you wish to pause at any time, you can. Or you can scroll through them under content, under textbook, PowerPoint, publisher slides. So here we go. I think we will start with this one. Here we go, chapter 5. So some of our learning objectives today will be kind of recognizing the symptoms of obsessive compulsive disorder. What is the difference between an obsession and a compulsion, and some of the theories about how we acquire these disorders. Look at some of the biological treatments again, and be able to describe some of the kind of common psychological treatments for OCD. So an obsession is a recurrent or persistent intrusive thought. So obsessions have to do with our thinking. Compulsions are repetitive behaviors or mental acts that are often time-consuming or distressful. So compulsions have to do with behaviors or repeated kind of behaviors that we do in our minds. Obsessions are these recurrent, persistent, and intrusive thoughts that we have. So there's like the common obsessions that we have are kind of like germs, viruses nowadays, some things about religion, oftentimes sexual thoughts will be these obsessions that we have. The compulsions help us to control these thoughts that we have that are intrusive and sometimes kind of distressful to us. That we often will have kind of rituals or things that we will have to do in order to control these thoughts or these behaviors. There's about, let's say about 2% of the Americans have an OCD diagnosis. Usually begins in early adolescence. Late adolescence, early adulthood. Oftentimes we'll see some kind of ritualistic behavior in children. This does not mean that they have OCD, but we need to make sure that we can watch and make sure that these rituals that oftentimes kids will pick up as they're growing up don't continue into their early adulthood. The little circle here kind of gives us an idea on what is the cycle of how OCD works. We start here at 1. We have some kind of obsessive thought that enters our mind. We get anxious about it here in 2. We try to handle the anxiety with some kind of behavior that becomes compulsive. In other words, we have to do it. And then we get some kind of relief here in 4. But then the obsessive thought comes back. And then we have the anxiety. And then we have the behavior. And then we get some relief. OCD is going around this circle over and over and over again, trying to get some relief, but always coming back again to this obsessive thought. So some of the disorders that are associated with OCD are body dysmorphic disorder, hoarding disorder, trichotillomania, and excoriation disorder, and we'll talk about them a little bit in brief. So for people who have body dysmorphic disorder, they are preoccupied with some kind of perceived defects or physical flaws in their body. they will tend to focus on that part of their body, feel that there's something wrong with it, that they're somehow ugly. Other people are not this way, and it becomes a problem for them that they continue to have this thing. It can become very serious because when we have an obsessive thought about our own body, we oftentimes feel that there is some kind of fatal flaw with ourselves and can lead to um, extreme behaviors such as suicide. Hoarding disorder, we've probably seen some of this or maybe know someone in our family who has a little bit of this or a lot of this. There's also been shows on TV and on the internet, on YouTube, about hoarding disorders. This is where we tend to have a hard time getting rid of certain things like newspapers or possessions or things, and we continue to pile up around our house and wherever we could keep them. And we have high anxiety if we have to, if they are removed from us. Trichotillomania is basically we're pulling our hair out, or not necessarily out, but keep it pulling it. Oftentimes the whole follicle will be removed. This happens in any place on our body that has hair, and can be very anxiety producing for those people who have it. Oftentimes kids the ages of 10 to 13 will have this kind of anxiety or OCD kind of disorder. Skin picking is basically where we will damage our own skin by somehow scratching and then continuing to pick, even though it's bleeding and can get scars or infections or have ulcerations. In this, and it is a kind of an obsessive compulsive thoughts leading to behavior, leading to relief, leading to thoughts, leading to behavior, leading to relief, and around we go. Some of the other impulse control disorders are pyromania and kleptomania, which you probably have heard of. Pyromania is basically a deliberate or intentional setting of fires for pleasure. In this could be just mental pleasure, could be sexual pleasure, a desire to see fire, an excitement at setting fires. More common in males, from what they tell us in our research. Kleptomania is basically a failure to resist urges to steal items that aren't needed. So these are people who are stealing things, and we've seen this in some of our maybe more affluent movie stars who are caught stealing small items that they could have afforded to pay for easily, but they need the thrill and they can't resist that urge. That's again obsessive compulsive urge to do it, to shoplift or take stuff that's it's not theirs. OCD kind of tends to run in families, as we saw in the anxiety disorders. This is the kind of the behavioral and the psychodynamic theories of why things like these disorders occur. Primary treatment for OCD and impulse control disorders are kind of biological medications that control the anxiety, and then exposure or cognitive behavioral therapy along with it. So selective serotonin reuptake inhibitors, again, are a medication which have that side effect of calming. Other kinds of medications are often added by the psychiatrists if the OCD is severe. And that brings us to the end of our chapter there. let's get to our second chapter for this week. Um, Let me close this out here. Here we go. And there's chapter 6. Let's see. Here we go. Hang with me here. There we go. I found it. Excellent. All right. Here's chapter 6, the somatic symptom and dissociative disorders. So we're going to take a look quickly here at some psychological disorders that are somatic or body based. Oftentimes called conversion disorders, where it's a psychological disorder is or an issue is converted into a physical symptom. And we'll talk about that. We're going to talk a little bit about the dissociative disorders, the amnesic disorders, and DID, dissociative identity disorder. So somatic symptoms and related disorders are characterized by excessive thoughts, feelings, and behaviors related to somatic or body feelings. When this is happening to us, we really actually do feel real physical symptoms, even though they can't be explained by any kind of medical condition or illness. These are oftentimes these conditions are brought to us by our mind. Our mind is actually causing these symptoms to occur, even though there is no physical cause for, say, pain. We will feel pain because our mind is producing it. Oftentimes, somatic symptoms will include back pain, chest pain, headaches, and are pretty much any kind of symptom that we can have in our body will show up in this. The conversion disorder can oftentimes leave a person paralyzed for no medical reason, or actually blind for nothing wrong with their eyes, no medical reason. This is, again, the mind is converting some kind of problem that it's having dealing with the environment and causing it to come out in this physical bodily form. Illness anxiety disorder is basically fears or concerns about having an illness despite any kind of medical reassurance. This is hypochondria, as is previously known as hypochondria. Basically, this is when we're worried about we have all kinds of diseases, or that we have some kind of virus, when the doctors say we have tested negative for it. About 14 to 20% of people report kind of physical symptoms that have no organic basis. So they would fall into this somatic disorder range. Some kind of psychoeducation usually is the first kind of treatment for somatic disorders, educating people about how the mind can work and how it can do this. There is some use of medication at times for this, but oftentimes cognitive behavioral therapy is used, relaxation training, some ways to kind of divert attention away from the physical symptoms. Mindfulness meditation is helpful for this also. So let's talk about the dissociative disorders. So dissociative disorder is basically where we have a disruption between the consciousness of memory, identity, and emotions and our environment. So we have well, let me just explain some of the kind of different experiences that we can have as dissociative disorders. We can have depersonalization, which is when we feel like we're not in our own body. We are having an out-of-body kind of experience. We're detached from ourselves. There is derealization, where you feel unfamiliar of what's going on in the environment. You don't, you have a lot of confusion. You're not sure where you are. Amnesia, basically a lot of not being able to remember things happen maybe before or after a trauma or during a trauma. Or if it's some kind of physical amnesia where there's an injury to the brain, you don't have to have a trauma other than the disease that is causing the physical problems with our brain. We have identity confusion, where we can kind of lose who we are, and kind of identity alteration, which we kind of assume a different identity. Dissociative identity disorder used to be known as multiple personality disorder. Very popular. A lot of novels have been written about this. TV shows have been made about this. And this is where one person will take on different personality, or what they call alters. Different people live within the same body. Sometimes they know of the other's existence, sometimes they don't. And it is somewhat difficult to treat, as we're trying to treat them. Usually it's treated by those that specialize in DID disorders. Lingering is basically when you're pretending you have a psychological disorder and you're gaining from it. In other words, you're because of what's happening with you um, psychologically and somatically, you're avoiding either work or some kind of being responsible for your behaviors and, say, like criminality. Brings us to the end of our 2 chapters, and thank you for being with me again. Check our syllabus to see what's due this week. If you have any questions, reach out in the email. Until next week, see ya.